How does breastfeeding affect postpartum depression? How does breastfeeding affect postpartum depression? This is an important question for many new mothers. Postpartum depression is a mood disorder that can happen after childbirth. It brings feelings of sadness, anxiety, and fatigue. These feelings can make daily life challenging and can affect the bond between a mother and her baby. Research shows that breastfeeding can play a role in reducing the risk of postpartum depression. Women who breastfeed often have lower rates of this condition compared to those who do not. In fact, mothers who plan to breastfeed and successfully do so are about 50% less likely to develop postpartum depression. This protective effect comes from several factors. One key factor is the releases of hormones during breastfeeding. When a mother breastfeeds, her body releases oxytocin. This hormone promotes relaxation and bonding between mother and child. It can also help reduce stress, which is beneficial for mental health. Additionally, breastfeeding supports the baby's brain development, creating a positive cycle for both mother and child. The duration of breastfeeding also matters. Mothers who breastfeed for longer periods tend to have a lower risk of postpartum depression. Those who are actively breastfeeding at any time have a statistically significant lower risk compared to those who are not. This suggests that ongoing breastfeeding can provide continued mental health benefits during the postpartum period. However, not all experiences with breastfeeding are positive. Some women face challenges such as pain, infections, or low milk supply. These difficulties can increase the risk of postpartum depression. If a mother struggles with breastfeeding and has to stop early, it can lead to feelings of failure and frustration. This emotional stress can trigger or worsen postpartum depression. Cultural factors also play a role in breastfeeding and mental health. In many cultures, breastfeeding is tied to women's identity and traditional practices. Support from family and community can help mothers continue breastfeeding and maintain their mental well-being. When cultural values support breastfeeding, women may feel less isolated, which can lower the risk of postpartum depression. On the other hand, a lack of support can increase stress and vulnerability. To help mothers, providing education and support about breastfeeding is essential. Addressing any breastfeeding difficulties quickly can prevent early cessation and the associated mental health challenges. Creating community support networks that respect women's cultural backgrounds can also strengthen maternal mental health and breastfeeding success. It is also important to note that antidepressant medications can be safely used during breastfeeding when necessary. This allows mothers to take care of their mental health without feeling they have to choose between their well-being and breastfeeding. In summary, breastfeeding generally helps protect against postpartum depression by lowering stress and promoting bonding. However, challenges with breastfeeding can raise the risk of depression. Support and culturally informed care are vital for new mothers to navigate this journey.